The work continues to prevent the highly pathogenic avian influenza from disrupting dairy herds. Several states have had the virus infiltrate dairies. Wisconsin is not one of them. The goal of state health officials is to keep it that way. Dr. Heather Roney is a veterinarian and epidemiologist with the State Department of Agriculture, Trade, and Consumer Protection's Division of Animal Health. She oversees state cattle programs. Today, she joins us in studio for an update on the virus and the current state and federal orders that are in place to prevent its spread.
DATCAP has continued to respond to the HPAI outbreak since 2022. In that time, 40 Wisconsin poultry flocks have been affected, the most recent of which was diagnosed end of last week in Sheboygan County. To date, Wisconsin has not had any affected dairy farms. We continue to work with producers and veterinarians to test their herds when that's indicated.
Why do you think Wisconsin hasn't had a case of HPAI in dairy cattle? I mean, we are America's dairyland, so we got the cows here. Other dairy-producing states are seeing outbreaks. What sets us apart?
We've been closely monitoring the outbreak in dairy cattle since it was first diagnosed in March of 2024, monitoring the occurrences across the country, the 17 states that are affected. Epidemiologic investigations in other states have suggested movement farm to farm between farms was responsible for the movement of this strain from the Texas Panhandle region to the other states. With more than 5,000 dairy farms in the state of Wisconsin, there is movement almost every day of cattle across state lines. We don't, however, bring in a lot of lactating dairy cattle, lactating dairy cows themselves into the state. So this and the individual practices of our dairies here in Wisconsin may have helped keep our herds healthy. We are planning to participate in the National Milk Testing Strategy to continue to demonstrate the freedom from disease.
We'll talk more about that milk testing strategy. First, I want to remind people that Wisconsin dairy producers are under 3 orders, 2 federal orders, 1 state order that have been in place for not quite a full year yet. So give us a refresher on what exactly the state's doing currently to mitigate the spread.
In response to the 2024 outbreak of highly pathogenic avian influenza in dairy cattle, the first federal order through the USDA was issued in April 2024. That order required reporting of the disease, which was already required in Wisconsin, but made that sort of universal across the states, as well as required testing of lactating dairy cows prior to interstate movement. And we've seen great cooperation on the part of producers in following the testing that is required. The second federal order came just last December 2024, and that involves the National Milk Testing Strategy, which Wisconsin has signed on to participate in. We also issued a state order, I believe it was June of 2024, prior to sort of peak show season, requiring similar testing of those lactating dairy cows for cattle participating in Wisconsin fairs and exhibitions, whether or not those cows came from here in Wisconsin or out of state.
So the bulk tank testing, that's that National Milk Testing Strategy that Wisconsin signed on to. That's going to start soon, but it sounds like from the farm level, not much changes because this is all going to be happening behind the scenes.
That's correct. The National Milk Testing Strategy is based on a silo testing model, although here in Wisconsin, we'll be working with laboratories to obtain those samples and test for this disease. That's coming through cooperation with the quality laboratories, the folks in our agency, and folks with the Wisconsin Veterinary Diagnostic Lab, and those details are still being worked out.
Have people volunteered to get their milk tested just out of precaution, even if they weren't required to?
Absolutely. In the past year, we've worked with producers and veterinarians who are reporting unusual clinical signs in their dairy herds that could be consistent with highly pathogenic avian influenza and the case definition reported by other states. That testing has gone on through the cooperation with our Nuln Laboratory, Wisconsin Veterinary Diagnostic Laboratory, when indicated, and we have not discovered any cases to date. That's with over 6,300 dairy cattle tested in that last, I guess we are a year now past March. Additionally, there is a herd status program that is voluntary. Dairy producers in any state are eligible to participate. And here in Wisconsin, we do have a herd participating This allows them to move animals interstate based on the results of bulk tank milk testing, not needing individual tests for each cow prior to movement.
Dr. Roney, Wisconsin, do we have a response plan ready if we do find HPAI or the H5N1 virus in a bulk tank?
Especially with the increased testing on the horizon here, we have been planning since March on what would happen if that disease comes to Wisconsin, and we've been fortunate so far that it has not. On our website, datcap.wi.gov, if you navigate to our page for highly pathogenic avian influenza in cattle, there is a link to a document that lets producers know what they could expect if their farm were to test positive.
From just a general standpoint, is it similar to what happens if a poultry flock contracts the virus, for example?
So there's some similarities and some key differences in this disease between poultry and dairy cattle. This disease is devastating for our poultry industry. When a flock contracts this disease, many of them succumb to the illness. That's not what we've seen reported for dairy cattle, and thus our response has to change and adapt to what's being seen across the country. Either due to sick cattle or surveillance detection, if a farm were to be positive, the producer would be contacted and would work with the veterinarians and staff through our office and the USDA on what that process looks like. To prevent the spread of disease, movement would be stopped temporarily while we collect epidemiologic information about how that herd contracted it and what movements have gone on recently.
Does this underscore the importance of premise ID? I know the Wisconsin Livestock Identification Consortium right now is in that renewal period, reminding anyone with livestock to register or renew their premise ID. I mean, that's something that the state needs in order to prevent further spread or to alert livestock producers that they may be at risk of their livestock getting an infection.
Premises ID is key to traceability, and it's been required in Wisconsin for livestock operations since 2004. Another part of it that I think folks might be less familiar with is that the contact information provided with that premises ID is a main method of getting information out in an outbreak situation. So that information is used when a farm is affected, not just for that affected farm, but the farms in the surrounding area to make sure that they're receiving time-critical information about that outbreak so they can make informed decisions to keep their animals healthy.
Dr. Heather Roney joining us in studio. She's a veterinarian and epidemiologist with the State Department of Agriculture, Trade, and Consumer Protection's Division of Animal Health. Dr. Roney oversees state cattle programs. If you'd like more details regarding the highly pathogenic avian influenza in dairy cattle, visit DATCAP, spelled DATCP.wi.gov. There you can find information on the status of the virus, the testing orders that are in place, biosecurity advice, and other resources. For the Midwest Farm Report, I'm Stephanie Hoff.